Member from Saanich North and the Islands.
Yeah, thank you, Madam Chair, for this opportunity to speak to Bill 36, the Health Professions and Occupations Act. It's dense work from what it looks like from the Minister of Health. Indeed, the largest, I think, piece of legislation that I've seen in my days here in the Legislature, and it's as has been mentioned by the speakers previous. It's going to take some time to get through this as we do the second reading and as well the committee stage on this bill. This particular act repeals and replaces the former Health Professions Act, and it's building on the work of a steering committee that was created from the 2019 Cowichan report. This goes back to when we were in the confidence and supply agreement with the BC NDP government. I was about to get there. They're really wanting to make sure that there's full and broad all-party support on this.
Well, I think it's signaling a snap election.
Oh, right. Everybody's got their opinions. And arm waving that's going on. Thanks, Madam Chair, for keeping the decorum in this place. Anyway, this goes back to a time when the leader of the third party and the member from Kelowna-Lake Country and the minister worked together in a really good way to bring forward the recommendations into this legislation that we are debating today. This is a good piece of collaborative democratic work, and everybody was very eager for me to get to that point. But I think that it should be held up. It should be held up as to how work in this legislative assembly can happen across party lines, despite the differences of opinion that happen here frequently or infrequently, depending on your perspective. The reality is that there's a lot of agreement that happens in this assembly. And yes, we do like to highlight the areas that we may not agree with each other. However, I think that it is important to recognize that when we sit around the committee table together, when we look at the work that needs to be done on behalf of creating legislation that works and regulation that works for British Columbia, and there is a lot of agreement on all sides in all seats of this House. And I think that what we see here in Bill 36 is a result of work that was done, collaborative work, proactively collaborative work that was undertaken by the Minister of Health. Didn't need to take this approach, but chose this approach to be one that was going to give the outcome the greatest chance of success. And as the member who spoke previously to me mentioned, that there is a role that the opposition plays in going through clause by clause in the legislation to ask the minister why this choice or why that choice was made when the bill was being drafted. That's the work that we do here on this side of the House. It doesn't mean that there's disagreement on the bill overall. There might be some different opinions about how we would approach certain aspects of this policy work. However, overall, I think what you're hearing and what the people are hearing about this important legislation is that broad support. Out of that 2019 steering committee and the Cowichan report from before that, this bill is taking those recommendations and bringing them into law, or providing the regulatory ability for the government, the minister, to regulate. The bill creates an oversight role, the superintendent role, which currently doesn't exist, as well as a reformed complaint process, independent discipline tribunal, and changes the structure of the boards from elected to appointed on these colleges. Continues to reduce the number of colleges in a process that the minister's been undertaking in advance of this bill from 20 colleges that currently exist in the province down to 6. The regulatory colleges hold a register of all of the professionals working in a field, in a sector. They set standards of practice, they set and maintain standards of education and training, and hold professionals to account through complaints, investigations, and discipline processes. these bodies are really critical to ensure that the people who are treating British Columbians, who are assessing their health and well-being and administering the treatment are professionals, that they're accredited, that they're educated, and that there is a process to hold those individuals accountable should they make mistakes in the work that they're doing. There are currently, or there was, and in the process of reducing, 20 regulatory colleges in the province that was established under that Health Professions Act. And that now, as I mentioned earlier, is being reduced to 6. Reducing the number of colleges makes for more efficiency, specifically from a government relations perspective. I can imagine the Ministry of Health and ministry staff are going to be quite happy to have fewer bodies to be able to relate to larger cohorts of healthcare professionals and occupations. It's also creates more efficiency for smaller professions like podiatrists, for example, and be able to set consistent standards across professions as people move towards team-based care. I think as the province, and it's been a project that I know the minister, when he visited my riding early, very shortly after the 2017 election, the minister visited my riding, and we talked about with my constituents about the move to team-based primary care. And I think that this is a process that is underway, it continues to be underway. I know that many people in my community and communities across the province really yearn for a time when that work is, we see the fruits of that labor and can benefit from it. However, I think that as we're taking a look at the regulatory side of it, of the colleges and the consolidation of these colleges from 20 to 6 will really help in that work environment on the ground in communities in that team-based environment. You can just imagine having 20 different colleges involved and the complexity that brings. So the 6 new colleges that will exist as the minister continues the work will be the College of Physicians and Surgeons, the College of Oral Health, the College of Allied and Care Professionals, the College of Pharmacists of BC, the College of Nurses and Midwives, the College of Complementary and Alternative Health and Care Professionals. So as I mentioned earlier, this bill will create a superintendent role to act as the oversight over the colleges. The superintendent is responsible for setting and guiding principles of the colleges, supervising their conduct and investigating when necessary, running an independent discipline office when that's needed, and running disciplinary panels as they're required. Creates an independent discipline tribunal and a reformed complaints process that increases accountability and transparency. Really, I think what is important to highlight here is that when it comes to people and their health care, when it comes to people and the relationship with those who are delivering that care, these are some of the more sensitive conversations that we have with professionals, our personal health and well-being, the state of our health. And I think that what's important is that the outcome of this process is to ensure that people who are in these vulnerable states are protected, and that as well, that we're ensuring that the most qualified people are working in the field. This bill distinguishes between a profession and an occupation and creates a regulatory program for lower risk occupations to be regulated but not designated. And I think an example of this would be healthcare assistants versus counselors. It expands the regulation of service providers, and in the next steps, the minister is going to be regulating counselors, and then following that, diagnostic and therapeutic professionals. And I know since my election in 2017, I've had some regular advocacy in my constituency office requesting that the provincial government regulate councillors. And I'm very pleased to see that advocacy has turned into a process where that will be undertaken. It expands, and as well, it streamlines the process for designating new health professions and occupations. And so this gives, I think, a pathway for this minister and future ministers to be able to recognize and acknowledge new health professions or occupations that may emerge as time passes. We know that in October of 2020, the BC's 3 nursing colleges were amalgamated into one college. In September of 2021, the nursing college was amalgamated with the College of Midwives, and the College of Physicians and Surgeons was amalgamated with the College of Podiatrists. So as I mentioned, this is a process that even as this bill is being developed, the minister has been proactively working towards the consolidation of these colleges, the simplification of this. And in September of 2022, just a few weeks ago, BC's 4 oral health colleges, which included the dentists, dental assistants, dental therapists, denturists, dental hygienists, and dental technicians, were all amalgamated into one regulatory college. Also, this bill, I think it's important to acknowledge here, and I've got a few of the recommendations from the In Plain Sight report. And this has been an unfortunate part of our history, and just with respect to how Indigenous people can access healthcare in our province and the experience that they have. We know that just a year or so ago, we have a report that highlights the experience of many thousands of Indigenous people in British Columbia who courageously shared those experiences, and those have been identified and published in the 2020 In Plain Sight report. Well, it's not 1 year ago, it's 2 years ago. It just goes to show how quickly time passes in this place. And this bill is beginning to take some action on that report. Specifically, there's a number of recommendations, but specifically there are 4 recommendations that are highlighted here and that may be addressed with this bill. Recommendation number 4, number 5, and number 20. I think it's important to acknowledge that in the committee stage of the debate, I will be taking some time to talk with the minister about just exactly how this bill addresses the report that the government has in front of it. It might give some opportunity to ask the minister on the record and just for his purposes, the progress that's been made overall on that report, and how these new colleges and how the government will work with these new colleges to ensure that anybody who is a registered professional or occupation working one of these occupations is implementing through their colleges all of the recommendations from the In Plain Sight report. So that will be something that I'll be asking the minister about. So I guess it's just, it's important to acknowledge that the government will be, this will be going from a process of where the members of the boards of these colleges will be no longer elected from the membership, but rather they will be appointed from the government. There will be some questions about that and the choice to move from election process to an appointment process from the government. But overall, I think that what I'd like to highlight in this debate is really the first remarks that I made as I'm speaking to second reading here, and that is the collaborative process. So often we can land on the disagreements and the differences of opinion, and also we need to stop and pause and recognize the areas of collaboration. And if we're just kind of passing over them and not reflecting on the areas where we've been successful together, then it's going to feel fleeting. And so it's important for us to be able to recognize the member from Lake Country, the member from Cowichan Valley, the Minister of Health have really over the last number of years worked together to get this very substantial reform in our government and how the healthcare professionals and occupations are governed, their oversight, transparency and accountability, how that's managed. I look forward to asking and to engaging the minister in questions. I look forward to the questions from our colleagues here and the members of the official opposition, and I appreciate this opportunity to speak to second reading today. Thank you.